already on. We'll just give it, I know it's Monday morning, so we'll probably give it another minute or so, Aaron, and then we'll kick it off. Todd, do you want to just share the slides? Great, thank you. Okay, great. I think, Aaron, I'll kick this off again. Thank you, everyone, for joining our kind of a host of different webinars that we're putting together related to COVID and the reopening of schools. Today, as you know, we'll be talking about communications as a specific topic and provide you some additional details in terms of what should be put together to ensure that your stakeholders are well aware of what your plans are, what you're going to do in terms of the education delivery, what are you going to do in terms of safety and health and protection for everybody who comes into your school buildings. So with that, I just wanted to maybe provide a quick overview and agenda in terms of what we will cover today. So I do want to address something up front real quickly, because since the last webinar that we've had a lot of changes, a lot of confusion, a lot of discussions in the public in terms of the health and safety issues as it relates to COVID, and some of the steps that need to be taken to ensure that we reduce the spread of infection. It's clearly a very challenging time, I think, for school districts, but everybody else too, because including parents, including students. My daughter actually had an opportunity to go take her ACT test in Jordan High School, even though we live in Plymouth, Minnesota. That was the only one that she could get in. And all the precautions that had to be taken to ensure that we have the separation. A lot of the kids were actually wearing masks, some were not, which was interesting. So clearly it's a kind of a changing world. I think somebody said it's a new normal. I think we call it the abnormal. And I think this is going to continue for a long time. So I wanted to address just a few items, and I've got a few other people online here. So just as you know, as we went through this process, we've also retained Fred Nolan, who used to be the executive director of MREA. He's going to be one of our ICS consultants as we move forward with this COVID issue, because I think this issue and the changes that will happen will continue through the new school year. So we wanted to bring in somebody that's connected very closely to MDE, MDH, and other agencies that could provide some good, valid information back to you. If you do have any questions as we go through the process, there's a chat function. Put your questions in there and Aaron will be able to answer some of those. So Fred is online too. We also have Neil Carlson from the University of Minnesota. He's been very, very active in terms of putting together procedures, protocols, approaches in terms of how they're going to open the University of Minnesota as we move forward. So I do want to spend maybe a minute and have Neil talk a little bit about some of the changes we're seeing in terms of how we address this issue around reducing the transmission, especially in schools. So I'll pass it on to you, Neil.
Thank you, Arif. Arif and I had a discussion before the meeting, and I think the main piece that's coming out, there's a very good article from the CDC director in the Journal of American Medical Association about using multiple tools to reduce the transmission. And one of the ones he mentioned in particular was using masks. And the data on cloth masks in particular is really encouraging with respect to minimizing the spread. The distance that the viral particles travel is reduced by a tremendous amount by having a good cloth mask. By a good cloth mask, I mean something like this. This is an Olsen style mask, and in the inside of the mask, there's a filtrate filter that really reduces, you can get a particle efficiency of about 6. Commercial availability of the masks that I tested, the typical one is like this. It's a looped mask. These are very ineffective. They're and don't provide much protection at all. In fact, they don't cover the nose. In fact, if you walk around, you'll see people having their mouth covered and not their nose. And that's not providing any protection to anybody else. So those are awful. The other one is surgical masks. They have ear loops. These don't work very well. And there's a lot of gaps around. You can help that out by having an ear saver, which is something like this that'll pull it in closer. What we're talking about with some of the professors that we have at the U is they're quite a bit of ways from the students. So we've incorporated the possibility of using both a face shield and a surgical mask if they're a long ways away from the student, having a face shield, possibly having filtered air being blown into this space. And then when they get close to the student, wearing a respirator. And if the teachers are trying to protect themselves, the mask will protect the other people, but they aren't going to be terribly good at protecting the teacher. But the face shield will actually have some protection for the teacher when you're having a short interaction. I think the main piece that we have to look at is that wearing masks has now become something associated with the identity of the person. And some people really don't want to wear masks. And to change that belief system will require changing their core beliefs. And that's going to be incredibly difficult. And we have people burning masks and doing other things that are not intelligent, that are not associated with reducing risks. And we also have to think about students. It's the last piece. They're wearing masks and getting compliance so that they will have their nose and mouth covered effectively is a monumental task that will be incredibly difficult. Anything else, Arif?
No, I just wanted, just because I think there's a lot of discussions, we've had a lot of questions in the past about masks. I just wanted you to address some of those. We will have some additional information with forward. I know you send me those. I'll make sure everybody who's attending this goes through. So I think we made it a lot easier now for you, Todd, in terms of now you have to change the belief system of people too with your communication plan that you're going to lay out. So I'm going to just make your life way easier. So with that, just a disclaimer as always, as we provide this training and information, we're not legal, we're not medical, we're not providing you those kind of advices. If you have any questions, please reach out to your specific lawyers, your medical experts, your public health people, and state and local representatives. So with that, I'll pass it on to Todd.
Thank you, Arif. Welcome, everybody, on this Monday morning. The discussion we're going to have today is on communications. And specifically, it's not going to be addressing some of the public health or engineering questions that you may have. This is going to be focused very much on how you reach out and connect your stakeholder groups as you're beginning what is probably going to be one of the craziest school years that we've ever seen. I know that each of you are already pretty good communicators to be in the roles that you're in. And my suggestion to you isn't that you wouldn't communicate regardless, but rather what I'm hoping to share with you is a way to develop a discipline plan. And my reason for that is because as the craziness happens and as things change literally on a week-to-week basis, it's important for you to be able to go back to a clear plan of action for how you're going to communicate outwardly. And for those of you who've worked with me before, you probably heard me say this once or twice, but that is, if you're not communicating well, people will go get their information from other sources. And those other sources may know what's going on in schools, or they may not, but they'll still be spreading information. And that's why it's so important you have a discipline plan. This PowerPoint is going to be available afterwards for you for use. And we will, if we can't answer all the questions during the session, any questions you send during the chat, Aaron and I will post answers to those questions afterwards. So please feel free to ask whatever. Now, I want to break this down into kind of the three different kinds of guidance that you have. The first is the requirements. There are some very specific things that the Department of Health is telling schools that they need to do. They must be implemented. Now, most of these apply to scenarios 1 and 2, the either in-school learning or the hybrid learning. We are going to go through these requirements step by step during this presentation and talk about what each of them means. The second area of guidance is recommendations. Now, you've seen these in Department of Health and Department of Education literature already. In fact, there was a brand new released on Friday specifically directed at parents of students to look at for the COVID-19 practices during the 2020-21 school year. There's also recommendations from a variety of other sources, some excellent recommendations. And if you took all those together and tried to do them, I don't know how you'd have time to actually put together the curriculum that you need to use with students during this school year. So recommendations are intended to be used as guideposts. Districts should, as much as possible, implement them, but it's understood you may not or may choose not to implement all of them. But there's a third area of guidance you should be thinking about, and that is your experience and common sense. And use your past practices and the resources that you have and other touch points that guide what you do. And I'm going to talk extensively after we talk about the requirements. I'm going to talk about how to bring the recommendations, your experience, and common sense together in one cohesive plan. I also want to remind you that we've got, as you know, we have 3 different scenarios, and within each of these scenarios, there will be different challenges, there'll be different activities within the building, there'll be different way you reach out to parents, and I probably could develop another 12, 15 columns here. The point of this is not to be all-inclusive, but rather it's to remind you that underneath each of the scenarios, there is a different way of approaching communications. Same level of discipline, same need for a fixed plan. But remember that there's no plan that's complete until all the scenarios have been thought through. So let's begin by talking about the Department of Health's requirements for school districts. And we might as well just admit from the beginning, they may very well change. Things that are today recommendations may become requirements. Things that are today requirements may be changed greatly over the next several months. That's because none of us has lived through a coronavirus pandemic such as this, and so we're learning as we go. In the words of Arif, this is a design and build project, okay? And as a result of that, you need to know that to be flexible and to pay attention to what the Department of Health and Department of Education are posting on their websites. You're part of good organizations that will deliver that information, but I'll be honest, I think you have to go through it yourself. I read the summaries of the Department of Health's requirements, but it was only once you unwrapped them that you really understood how they impacted communications. So there are 2 different requirements on the area of points of contact. That first requirement is that you have a program coordinator, a point of contact in each building, and then a second requirement that you designate a staff person who will be responsible for responding to COVID-19 concerns, such as a school nurse. Now, it's not clear that the first person or the second person could be the same or different, but there's somewhat of an implication that they're looking for 2 different people. And in part, it's because your program coordinators are a building by building position, where the staff person in the second paragraph may very well be a district-wide position. I would tell you from reading these that I think they're preferring it as a full-time person rather than a part-time person, simply because the communication will be easier. It's also clear that these people need to be given the freedom to give you the feedback, criticism, and improvements to improve your local plan. Finally, while it doesn't say this in the requirements, I would suggest that you have a plan for who the backups will be, because any staff person could eventually get COVID-19. So those are the 2 requirements on points of contact. When you see each of these slides, these are quotes taken directly out of the MDH guidelines. Now, on requirements for hygiene, there's only one clear, direct requirement. There are a number of recommendations on hygiene, but the one thing you must do is teach and reinforce hand washing with soap and water for at least 20 seconds and/or the use of hand sanitizer. Now, by putting this as a requirement, I'm inferring that the expectation is that educators are leading this communication, That's more than just we're going to put up some signs, and we'll talk about signs in a few moments, but rather they're expecting all teachers to join in on the communication efforts within the student body and among other staff people. The other hygiene recommendations do imply further communications. I will call those out as they fit into specific requirements, but I think you all have to understand that while MDH is only specifying this particular hygiene requirement as something that must be specifically taught, they are certainly implying that you can and probably should talk about other hygiene steps in your communication. The next requirement is signage. There's two specific directives within the MDH guidance. The first is that you post signage at main entrances requesting that people who have been symptomatic not enter the building, and then that you mark 6 feet of spacing to remind students and staff to always stay 6 feet apart in lines and other times where they congregate. Now, they're promoting signage of other issues, but these two specifically, signage at any main entrance, and my assumption would be that that includes, but may not be simply limited to, places that are a secured entrance that has a staff assigned to it, either because it's a main office or for any other reason. But there's no reason why you couldn't have signage at every entrance that people use, even if it's staff only. In terms of the 6 feet of spacing, I'm sure most of you, if not all of you, have been to whether it's a grocery store or a general store of some kind that has that spacing, and they're expecting that reminder to be there in the halls and probably near the teacher's desk. This also implies that screening questions may be necessary at entrances, and while it's not specific in the requirement, if they're asking you to request people who've been symptomatic to not enter the building, standard practice has become to ask a series of 3 to 5 questions to determine whether or not people have the symptoms. Next requirements deal with discovery. The first indicates that you should educate staff, students, and families. And let's stop there for a second. This is a time when it specifically requires a district to reach out to families with information so the communication will go beyond the school about those signs and symptoms of COVID-19 and when children should stay home and can return to school. The second requirement is that you need to communicate expectations and processes for your screening methods that you're using. And the third is to create a system of self-reporting for staff and families to use. And you can see that there's an extensive amount of detail there, including a link back to specific federal laws on health data privacy and educational rights. So the goal here is to proactively encourage the understanding of symptoms and to have transparency in what your screening process is. But remember, it's also about having a safe way to individually, voluntarily self-report. And this will be the first of several consecutive slides where I say it may be helpful for you to develop your local process and then talk to your attorney and to make sure that it reflects each of the different laws that are being governed here. Because now we're no longer into just state law or state requirements. We're now looking at having to deal with federal requirements. In terms of notification, MDH will require you to notify them about any cases with students and staff, and they've already created an inbox for you to do that. But they're also directing you to develop systems for notifying staff, families, and the public if needed, because a person has COVID-19 who's on school premises. Now, it's important here to note that when I'm talking about a communication plan for you, this is probably about 5% of the communication plan, which is how you're going to report when a case is there. A lot of the communications we're going to be talking about go way broader than that. But the goal here is to make sure that when you have a case, you need to share that information with the community. Not names, not conditions, rather the fact that there is a case. I would also suggest that you have a Q&A ready to use. So the moment a case occurs, you can post it on the website so people can go there to get information. Now, this one's getting to be a little more complicated. There is a requirement on self-identification of risk. And what we mean by that is that you need a process for your students, families, and staff to be able to self-identify themselves as a high risk for illness due to COVID-19. Now, this is a difficult line to walk because you are not permitted under law. And let me just stop for a second. I'm not an attorney. And what I'm about to give you is not legal advice. What I'm going to tell you right now is from a lay perspective, you are not permitted to put your families or staff in a position where they must tell you that. Rather, you need to create a process that allows them to self-identify and share that information with you as they see fit. Now we're into the Americans with Disabilities Act guidance, in addition to the guidance that we talked about before in other federal laws. So it is very important that if you're uncomfortable with how to do this effectively, you talk to your attorney. And according to MDH requirements, you must, when they self-report, have a place and plan to address the request for either alternative learning arrangements or work reassignments. Again, this is guided by the ADA as much as it is by any Department of Health needs. And a requirement is included on ongoing engagement for students who cannot be present in school. Now, my assumption is that this is fundamentally a situation where you have a couple of cases that occur. Most of the students are staying in the building or continuing to follow a hybrid plan. But what the MDH requires is that you maintain engagement and offer distance learning activities for students who can't be physically present. Now, this wouldn't exist as a requirement, I believe at least, if MDH was saying that your only job is to make sure they get their lessons and complete them. It appears that daily lessons are not sufficient to meet these expectations, and that there needs to be a level of additional engagement on top of that. What that is probably up to each of you locally, but you need a plan for if and when that first case comes, you are not just providing students with what they need to continue their classes, but rather to continue a level of engagement with the school community. There's also a requirement on additional support. And the requirement says that you need to provide staff, families, and students, age appropriate, with information of how to access resources for mental health and wellness. And I think that one's pretty self-explanatory, and you need to work with local health professionals to identify the appropriate resources to assist staff, families, and students. You should prepare a separate protocol if positive cases are discovered, because that's a different set of challenges, and it's going to create the challenges broader within the school community. Now, that's a summary of the specific requirements of the current MDH guidance to school districts. That could change, it could expand, and you need to keep an eye on the information that's coming out from both the Department of Health and the Department of Education. And as I indicated, it's a complex web of state laws, state rules, guidance, and federal laws and rules. And so please make sure as you're thinking about questions, I'm happy to answer communications questions for you and give you what I think I'm reading out of these. But you do reach the point where discussing it with your school district's attorney is probably wise, just to prevent, for example, an inadvertent violation of Hipaa. Now that you know what the requirements are, let's talk about building out your communications plan. As I indicated, your COVID communications plan begins at the center with these requirements, but then you bring together the expert recommendations you've seen, the experience you have in your district, and frankly, just a little bit of common sense. And I say that not because I think that the people on the Zoom call don't have common sense, but sometimes you get so wrapped up by what's written down on the sheets of paper in terms of recommendations that you can create for yourself truly a swamp of work. And use common sense to prioritize what you need to do and to use your current communications channels effectively. So I'm going to give you my own guidance as to how to put together and what your communications plan should include. I'll go through these relatively quickly because you can use the PowerPoint afterwards if you want to roll up your sleeves and get into more detail on any one of these items. But the first thing you need to do, and those of you who are on our earlier call, is complete your assessment of 2019 and 20. It's really important to look back and judge for yourself how well you did and what you want to improve. By the way, if any of you give yourself an A+ for communication in 2019, 2020, maybe you should go back and check the curve a little bit, because all of us were learning as we went along. And while there was some terrific communication done, I would argue that any district could improve the way they communicated in 2019, 20, and you could use that to better inform your plan going forward. The second thing you need to do is identify your stakeholders. And this is just an example of how to think about stakeholders. I call school board members tier 0 because it's absolutely critical that you have a great communication path going on between administration and your school board members. I'm not suggesting you don't right now, but school board members need to be kept up to date on what's going on, because they're getting questions from the community at a different rate, and frankly from different people that maybe are connecting with the school district. Tier 1, of course, is a group of people who most directly are involved with the district on a day-to-day or week-to-week basis. Although I included local health professionals in there because I think it's critical, if you haven't already, to develop that strong relationship. And then finally, tier 2 are some of the influencers that are in your area that you need to keep in communication with, because the fear is that people will reach out to them with questions, and if they're not well informed, they may not be giving the right answers. Now, you know what you want to communicate with those stakeholders? I try to think of this in terms of 2 different paths. Number 1 is information. What do you need to tell them about so they understand how the district is managing the COVID-19 situation? And then the second is engagement. How do you want to create the conversation and get the feedback that you need to tell you what you need to know about your plan and, frankly, to improve it? So think about all of your communication stakeholders in terms of information and engagement. If you need to do a communications activity that only requires information, that's fine. Or if you want to focus primarily on engagement, that's fine also. But understand when you're doing one of those or both of those in any communication activities that you undertake. I included here just an interesting little recommendation from MDH. Again, not a requirement or recommendation, but with your older students, to create a student position, in effect, that's a program coordinator role, to give student ownership and responsibility for a safe and healthy school environment. And that could come through your city or your student council or many other places. I think that's a great little recommendation for thinking about how students should be involved. Now, guidance number 3 from me: repeat, repeat, repeat. I think during COVID-19, the importance of getting a core set of messages and bits of information that you want to share and repeating those consistently is critical. This is all going to start during what's going to be a very controversial political campaign. We're going to have a lot of people out there who have uncertainty, fear. It's easy for communications to break down. Your people will gain more attentiveness to your messaging once some cases begin to accelerate or cases appear in the schools. And I think what you need to do is get a set of core messages right away and repeat those over and over again. And I know you're going to hear from some members of the community who say, I know you've already told me that. Congratulations. When your target audience begins to tell you that you're repeating yourself, you're just starting to get through to people. Okay? Develop the core messages, deliver those. Make sure your community is comfortable and understands that information. And then from there, you can adapt your communications based on what's going on in the school. Now, there are 3 key Department of Health recommendations that clearly fall under this repeat, repeat, and repeat guidance. First, the reminder on people staying 6 feet apart from each other when feasible. Second, information on the wearing, removal, cleaning, cloth, face coverings, and face shields. And third, the other tactics to promote health etiquette expectations and are posted in highly visible locations. Okay? Those 3 at minimum should be things where they should be a daily repeat of those, and you should be using multiple forms of media within the school, for example. you should be directing announcements, posters, flyers, and having teachers share information with students. And it may feel like that, and they may begin to give you the feedback, oh, we've heard that before. Great. Maybe they're actually learning it by then. Now, here's an example of a very simple stakeholder communication plan. You don't have to follow this one day by day exactly how I put it forward. But I did want to give you this so you'd get a chance to see that you actually need in every single day to be thinking about what are the 2 or maybe 3 things that you should be doing that day to communicate with your stakeholders. And if you think about it like that, all of a sudden it becomes pretty clear you need a formal plan and a grid. But you note with this, that you have if you follow this plan specifically, and I hope nobody does follow this plan exactly, but rather you develop your own, but you're going to have 3 meetings a week with staff, multiple meetings a week with community members. You're going to be keeping your school board up to date regularly on what's going on and engaging them by getting input back to them and so on. Okay, guidance number 4. Enforce organizational discipline. At a time like this, there's going to be a lot of communications that happens that you can't control. And part of the reason why you communicate often and repeatedly is to make sure that those people who are also doing the communicating are getting the right information. But in terms of official district communications, you need to have some control over that and control over who are going to be the communicators and the audiences, what the messages are each day, when to deliver those messages, and where to deliver those messages. And I would assume that you will default to everywhere you can. And think through specifically the who, the what, the when, and the where for your communications. 5th, message using the best facts and data. I showed this to a teacher before I was finished with the presentation, and the teacher's response was, yep, exactly. If you may feel like that you want to make your audiences more comfortable. And as a result, you may want to share with them your hope that things are getting better. I will give you my advice to you in terms of from a communications perspective. You want to focus on facts and data and not speculation and not promises and not predictions and not false expectations. And there's 2 reasons why. Number 1 is that you simply don't want to be wrong. The second reason is you don't want your district community to be in a situation where they are expecting things to be better, and then you have to announce that they're much worse, and then the community itself has to pivot. That's how you create a crisis out of a situation that is difficult but manageable. So my advice is that don't, especially I would say coming from the highest positions within the district, focus on the facts, focus on the data, leave the speculation and the promises to CNN and Fox News. 6th, encourage holistic health practices. Emotional and mental health are often the most ignored during some kind of crisis. And so my advice is that you consider ways to adapt your classroom environments and your daily activities to provide both needed physical activities as well as the support for the emotion and mental health issues. You can ask your staff leaders and your student leaders to become part of this. But part of it, as you know, is just keeping your eyes and your ears open to see how students are responding to things. But if you're so focused on delivering the lesson plans that we leave the physical, emotional, and mental health behind, you're going to eventually see problems that come from that in your district. So make sure you're encouraging everyone to think about health holistically beyond simply whether or not somebody has COVID-19 or not. 7, answer questions quickly and clearly. Those who worked for me before have already heard about the 24-hour rule. Then anyone who's thoughtful enough to email or call the district wanting information should receive an answer within 24 hours, even if the answer is incomplete. As you begin to get the same question over and over again from multiple sources, now that gives you a topic you can use for future communications to key stakeholders. And whenever possible, I am a believer that you should refer to third-party expert sources, including using web links or direct quotes like I've used in this PowerPoint. That helps build up people's trust in you and the information you're providing. Never forget the easiest answer to provide anyone. I don't know, but I'll find out and I'll get back to you. Just giving that answer helps build trust from the community. 8, seek feedback. Again, we're going through uncharted territory here. None of us have been through this before. And the only way we're going to know if we're hitting the mark or not is to listen to people, whether that feedback comes in the form of emails or phone calls to us, or maybe you do frequent short surveys for staff, parents, and students. You only need to ask 6 or 8 questions to understand if people are satisfied and to ask the question, what could we be doing better? I also encourage you, go back and look at that list of stakeholders and look at those tier 2 stakeholders for input, because they're having the same conversations that you're having with the community. You want to hear from them as to what they're hearing and maybe some of the things that are working for them. 9, prepare for the worst moments. I think one of the most difficult things in a situation like this is that we don't want to face up to the fact that things could turn through no fault of our own, and we could have significant issues that emerge within the district. But we do know from watching other service industries, whether it be the restaurant industry or whether it be retail or even healthcare, we do know that problems occur, and it would be very surprising if there wasn't a significant outbreak in at least one school in Minnesota this year through no fault of district leadership. So what are some of those worst moments that you need to be ready for? A significant outbreak, a fatality. And I'll pause for a second to say that I work for the 2 major nursing home and assisted living associations in Minnesota. The first case of COVID-19 was discovered in Minnesota on March 1st. And in less than a week, we already had a plan in place, not just for an outbreak, but if a fatality occurred. Why? Because it doesn't hurt to be overly prepared for these things, but the fact that we were prepared when there was the first fatality that hit Minnesota in the middle of March meant that we could handle the situation more professionally and more quickly than we would have if we hadn't thought through the situation. We also need to prepare for a second type of major virus going through the schools. And I don't want to step in for Neil, this is his expertise, but there certainly is no reason to believe that we can't or won't have multiple types of viruses in our schools in 2020 and 21. We also need to prepare if there's educational gaps that are being exposed. For example, certain communities of students are having difficulty keeping up. We also have to be able to communicate if we experience budget shortfalls as school districts, because the investment we're making in dealing with COVID-19 exceeds the current budget for the district. And finally, we've got to prepare to talk about our own mistakes. I don't believe your community expects you to be perfect. I think they expect you to be transparent, and I think they expect you to step up if there is a problem and admit what it is and give them a solution for that problem. Be prepared for your own mistakes. In each of these areas, be ready with a small plan, but also be ready with the messages you want to deliver the community if they were to occur. Then, after talking about your worst moments, let me talk for a second about your successes. We've begun to do research for school districts in various parts of the state. And one of the things we've learned is a key driver of confidence in the school district is not the matter of our kids being educated adequately, because a lot of people who live in your community just don't know how to answer that question. Rather, a more important question is, do you think the district has managed the transition to distant learning well? That's more an evaluation of the success of the district and your trust in them. So here, I've just listed some areas to think about. It's important that you communicate outwardly about what's happening in the district. Remember, we're going to spend this year educating these kids, and people still need to know about what we're doing successfully. People take great pride in their school districts, and they want to hear about the successes, not just the challenge of the pandemic. So in summary, start your plan with MDH requirements. Okay, that's got to be the core of every plan, and they're likely to change at some point. Second, solidify the plan with recommendations from experts, your experience, and your common sense. Build it out and write it and have it ready to go literally for the time when staff is going to come back to the school and begin to prepare for the first day the students arrive. Third, use your community stakeholders to assess and improve your plan. Fourth, remember that everyone is in this for the first time. None of us has a roadmap of where we're going to go. People will expect that you're going to make some mistakes. What they want to do is they want to get the information and they want an opportunity to give you feedback. So give them those opportunities. And finally, please watch for new and changing guidance. It could come very quickly, depending on what people are seeing, not just in Minnesota, but what they're seeing in other states. So that's my summary of the communications plan. I've tried to leave plenty of time for questions here, and we'll take up the ones that are in the chat room. But Arif, you want to talk about next steps first?
Sure. Thanks a lot, Todd. Thanks for all your time and effort in this. This entire program that we're putting together, I think, wouldn't have happened if these individuals with the expertise, whether it's Neil Carlson, whether it's Todd Rapp, whether it's Fred, dedicate a lot of time and effort into this. So again, thanks a lot, Todd. And also, I just want to thank Erin Sorensen, who's also on the call. She's our marketing director, and we've created a lot of stress for her. She has a normal job, and she's heavily been involved in putting all these programs together. So thank you again, Erin. Just a few points before we take some of the questions. So the PowerPoint slides, the webinar recordings, all of that is going to be available on our website. So you can click on that and all the information is there from the previous webinars to the most recent ones. We also have additional information there in terms of frequently asked questions, where we've answered all the questions that people have that we weren't able to answer on these webinars. So a lot of information there. It's very specific and you can pull that up. One of the things that, as you know, we have 3 other webinars planned, one dealing with transportation issues, which is pretty significant. We've got some really good expertise around that and solutions and ideas. We also have a webinar coming up relating to how you modify your facilities and retool your facilities. I think there's a lot of misinformation out there, a lot of people selling a quick solution. It doesn't really work. There's some basic things you need to go do and nothing more than that. So hopefully you'll attend that. And finally, we do have, as I mentioned in my original webinar, we did select 3 school districts where we're helping them with the entire program from start to end. They will be kind of case studies and live case studies. So that's the first webinar that we'll be doing, but we're going to continue with those through December. So we're taking those 3 districts, kind of larger district, a mid-sized district, and a small district, and sharing with you exactly what they're doing, the problems they're running into, and we want to continue that on a regular basis. The reason is I think that's where the learning really comes in when you talk about how those districts have solved some of those issues. You know, what's gone well, what hasn't, what processes have they implemented, and any key lessons that they've learned as they pull this information together. So again, the combined links and resources will be available at the end of the presentation. We have 3 other webinars coming out this week, again, around facilities, transportation, and those specific case studies, those 3 school districts, which is Mora Independent School District, East Central, and Bemidji. So hopefully you'll be able to attend those 2. So with that, maybe we can start to go to the chat and see if there are any questions, Erin, or if you have any additional items that I missed you want to address.
No, I think you covered it pretty well. Todd, we do have one question. Do you have any examples of a communication plan that you have created or used in the past and the layout?
Well, on the good question, and on the topic of a pandemic, I gotta say the answer is no, I don't. But let me tell you what I think you should include in a communications plan. Just to, and let's not let's not make this any harder than it needs to be. You've seen what the requirements are from the MDH, and I've given you my guidance for how you piece this thing together. You've undoubtedly got a variety of different things that you picked up over the last several months that you want to get done. So here is how I would put together this plan. And let me put it in terms of 6 different steps that I would put down on paper for a plan. The first thing is I would try to organize a committee of some kind to work together, meet frequently, oversee what you're doing. It should include a minimum of 1 person from each building. It should certainly involve your coordinator, and if you fill both positions, the 2 positions that the MDH requirements talk about. I would say it should also include somebody from the local health community to be there to provide advice. They're going to be getting some information more quickly about both what's happening locally and advice you're getting from the Department of Health. That you may find you get more information from them along the way. The second thing then you need is both key messages and key information. And those are really 2 different things that you want to share with your stakeholders. By the way, I would argue that in a pandemic, that's likely to change over time, that those will evolve gradually based on the situation in your district. The third thing you want to do is that you want to create a clear list of items that you expect every school building to implement, either before the start of school or shortly after the start of school. And that includes the communication we talked about earlier, and additional posters or flyers or announcements or what have you. But you should clearly list those for each of your buildings. The fourth thing I would do is I would select a spokesperson for the district. Often that would be the superintendent, and that's fine. Then I would select a backup spokesperson for the district just in case the superintendent is going to be home with COVID-19 for any period of time. But have a couple of people identified as being the go-to source for the district on this. Fifth, write a calendar. I think early on, it needs to be a day-by-day calendar of communications. Eventually, it can turn into more of a week-by-week calendar. Your calendar will also change just as your messages and information do, but get a calendar down. It's a lot easier to follow a grid that goes day by day than it is to follow some kind of checklist or worse, just some, the kind of the thoughts in your head. And the final thing, the 6th point, is the benchmarks. That is, how will you evaluate the success of your communications efforts? So have an oversight group to manage this, your key messages and information, your list of what you need each building to immediately prepare for communications, your spokespeople for the district, then your calendar day by day, and then evolving it to week by week, and finally your benchmarks. If you do those, you've got a terrific communications plan.
Thanks, Todd. We do have another question. I have searched for a form or a survey example to use with staff for them to self-identify being at risk for illness and have not found an example. Do you have one you could recommend?
Neil, do you have one?
Yes, there's a couple really good ones. I would go to the CDC website. They have some excellent pre-screening forms that you can use. There's also some other ones available actually from the Minnesota Health Department. And there's also pre-screening ones that are available. For instance, if you want to get tested, it'll put you through a whole series of screenings. And I'd recommend that along with some other screening tools that, figure out how you're going to do the temperature testing, figure out what you're going to do if someone tested positive or has a high temperature, figure out how you're going to isolate the situation. I think I'd echo what Todd said. Look for problems, anticipate problems, and lean into the problems. Don't run away from them. If you lean into the problems, it'll be much better.
Yes. As a quick reminder that we talked about 2 different self-identification issues here. One was self-identifying whether you have the symptoms, and the second the self-identify whether you have higher risks. And just remember, those are two different issues. They're governed by overlapping, but at times different sets of laws. And those are important things to really understand well for not just you, but for any administrator in your district to understand the difference between those two and how you manage them.
Neil, do you think you could provide us with those links that we could add to our website just for ease of finding them?
I will do that. And I think the other thing that administrators may want to at least familiarize themselves with is some of the guidance with respect to contact tracing too, so that you can kind of get familiar with that and then understand the difference between quarantine, isolation, and really get those terminologies down, because that's going to be a very frequent question that comes up. And at least have one of yourself or a person on staff that can really communicate that effectively, because it's sometimes difficult.
This is Fred. I just want to reinforce what Todd just said. What Neil's been talking about is how you find the presence of the disease, how you screen for the disease. The question really asks for a survey if you're at risk of illness. And that's where you really can't have a survey. You need to inform people. And Todd, you had a slide specifically on that. Maybe you want to bring that slide back up, because that question was specifically about the at risk for the illness. There you go. And Todd, you want to reinforce what you just said, that it's a self-identification?
Yeah, I mean, the issue, and again, I want everybody to be clear that I do not provide legal advice, but that the issue here is that people under ADA need to have the ability to come forward voluntarily and inform you that they have medical conditions that may increase their risk substantially for COVID-19. And then you are obligated to have a plan in place for how to provide the appropriate accommodations, whether they're a student or a staff member. And I'm being cautious on this only because this would just be an area where it would be greatly unfortunate if a district, through no faulty purpose in mind, but if a district had a problem with their staff or students around this issue because you became too aggressive in trying to find out who those students were or those staff members were.
Right. And on Thursday's call with the commissioner, Mary Catherine Ricker, directed the questioner to the Department of Industry and Labor, where they had a COVID information site. And it does have to do with ADA and its self-identification. And then that information must be kept confidential. So what Todd said earlier about interpreting with ADA, if you haven't looked at that Minnesota Department of Health, of Industry and Labor, I'd recommend you do so, because it's not something that school districts normally do, but it's clearly applicable in this case to understanding whether someone's going to be at risk, not whether they have the illness, but whether they be at risk, and how they report that to you.
And I think the other thing you mentioned that's important is what accommodations you're providing. So I think the challenging part here for all of you is going to be with the Hipaa requirements that are out there in terms of the information that can or can't be shared. I think this is one area I would say please consult with your lawyers, because this is extremely complicated. It's going to be complicated about your staff and their information, and whether you require, any staff can say, I have these illness. So what is your process typically in terms of, do you require physicians? No, do you require some of that documentation or not? What about when a student can't come to school because they have health issues, or somebody in their family, in their household is at higher risk and they're not going to come in, right? So there's multiple levels of issues you're going to run into. This is one area I think, you can't really do a survey to identify people. I think you really need to talk to your legal and say, what's our approach? What's the information we're going to send out to the staff, and how are they going to respond, so that we know who are the ones that are not going to be able to come. I know that school district, for example, we just, it was last week, sat down with Mora to see their survey. So we did do it. There was a survey that was done with all the staff, and we're able to get in aggregate information about what percentage of their staff will not could not be coming back because of the fact that they have some form of illness. We don't know who they are, we don't know the details around it. And that's going to be the challenging part in terms of them then self-reporting back to the school district so that we can start putting a different program around those staff. So this is a real challenging issue. It comes into public health issues, but it involves legal issues. And of course, how are you going to leverage those staff to actually provide the services that are required for educating kids?
I think the way we've handled it at the U, and I think school districts will have to think about it too, is we have an Office of Disability Services. So they're the persons that can get all this medical information and they store all that, and then they spew out a binary thing to the rest of the people saying, this is what this person can do. We're not saying why, we're just saying this is what this person can do. And then people have to act based on that. I'll give you one example. We have a person who is refusing to work. Why? Because his spouse has cancer and he doesn't want to bring back this to her. So he's saying, how can I go into work but not affect her at home? So there's a lot of really complicated issues that you're going to have to deal with.
Neil, we do have another question for you. Do you anticipate specific guidance changing from MDH or CDC on what schools will be required to do if positive cases are identified in a building?
I can take that one, Arif.
Yep.
The last MDH call on Thursday, Deputy Commissioner Mueller talked about, yes, there would be guidance coming out. There'd be close communication between the school and MDH about that, and there would be guidance of what to do. I can also say that they were asked about masking students, what Neil started about in the beginning of this session. And they said they have not issued any guidance yet, but they are working on it. So whether there'll be guidance or recommendations, we don't know. But those are one of the things we're just going to have to wait for.
Yeah, and I think, Todd, you had on one of your slides the email address, I think, for MDH to report those situations. I think they've set that up. I think, yeah, health.schools.covid. Yep. But I do think you're right, Fred. There will be very specific recommendations coming out on MDH in terms of contact tracing, in terms of all these items. I think going forward, the schools are going to need that clear guidance, or else we're going to have problems. And they're aware of that. So
I anticipate guidance on the masking. I think the problem is going to be in the younger students with, you know, how they're going to handle that, and then with the older students' compliance.
okay.
Those are all the FAQs that we had. We're right at 9 o'clock. So Reef, do you want to just wrap us up?
Yeah, no, thank you again, everybody, for attending. And I think what we'll do is, again, as I mentioned, we'll post a lot of this information on the website, so you will have access to all of this. And then again, with the resources we put together, if you do require, I think, Todd, you have your email address somewhere there in case people have any specific questions. They can reach out to Todd in terms of the communication piece. And we'll keep this information rolling. I think it's changing pretty fast. There'll be more updates coming, and we'll make sure that we keep you in the loop in terms of what's happening. Thank you. Take care.